Days before her death, Kathy Vandiver seemed to be faring better than her daughters had seen in years. After years of addiction and struggle, she had gotten off the streets of the San Fernando Valley and into a hotel room through Project Roomkey. She was talking about getting an apartment soon. She was bringing over friends to say hello on a video chat. She had a loving boyfriend. She had plans, once a check came through, to visit family in Illinois. She seemed healthy and happy, her daughter Karla Benitez thought. Like the mother she remembered as a kid. How could she just die like that? Benitez asked. Vandiver, 51, was one of at least 8 people who died while they were living at the Airtel Plaza Hotel, according to data provided by the Los Angeles County Coroner and the Los Angeles Homeless Services Authority. During the pandemic, hundreds of homeless people have been housed at the sprawling hotel and conference center outside Van Nuys Airport through Project Roomkey, a government program aimed at the vulnerable population. The deceased were young and not so young, black and white, local and transplant. Several lost their lives to heroin or methamphetamine at the hotel, according to coroner findings. Vandiver died of an intracerebral hemorrhage after being found unconscious in her room and taken to the hospital, though medical examiners found that medical conditions and methamphetamine use were contributing conditions to her death. One death at the hotel was labeled as natural, a 41-year-old man found to have died of coronary artery disease. And one participant died of natural causes away from the site, according to LAHSA records. What happened at the hotel is a reflection, in some ways, of the dire vulnerability of the homeless people who went there, and the maladies and addictions that can be exacerbated by living on the streets. But the death toll also raises questions about whether providers could better protect people as they move from the streets into hotel rooms and other shelter. LA County's top doctor responding to homelessness said it also underscores the lack of spaces where people with serious mental and physical ailments can go for care in Los Angeles. "We need a place for people who aren't just physically ill," said Dr. Heidi Behforouz, medical director for the County Housing for Health program. "It's for the people who are traumatized, or in the midst of substance use disorder, or are having a mental health moment, and just need some wraparound attention and stabilization. Our system is missing that." The Airtel is not the only Project Roomkey hotel where people have died. As of this spring, 49 deaths had been recorded among people who were living in Roomkey hotels, out of the thousands of people participating in the countywide program, according to LAHSA statistics. The majority of those deaths occurred on site.